Well, today's going to be a little unusual day because we have a different format than we normally do, because I want to talk about cystic fibrosis and muscular dystrophy. The cystic fibrosis part will be very short. Many of you know, back in 1977, I discovered the first non-human case of cystic fibrosis, recent monkeys, at Emory University and Yerkes Primate Center in Atlanta, Georgia. Everybody made a big hoo-ha of a big news release. It was a big story. And then when they asked me if I could make them some extra monkeys, how long would it take to get some more of these monkeys with this genetic defect disease, cystic fibrosis? And I said, I can make you 1,000 of them in 6 months if you want, because it's not genetically transmitted. It's actually a deficiency of the trace mineral selenium. And they fired me. They actually fired me back then and didn't even give me a chance to defend my research like you would a PhD student. So to make a long story short, that was in 1978 they fired me. In 1990, Dr. Milan and I, we went to Qishan province, China, where 13 out of every 1,000 kids there die of Qishan's disease, which is a selenium deficiency cardiomyopathy heart disease, which is what kills kids with muscular dystrophy and kills kids with cystic fibrosis. So we go there thinking, there's going to be some of these kids that die of Qishan's disease and cardiomyopathy heart disease are also going to have the lesions of cystic fibrosis. We go there, and sure enough, out of the 1,700 autopsies we did, 1,700, 1,700, 595, 35% had classic lesions, classic disease of cystic fibrosis in their pancreas and liver. Wrote it up, published it in Chinese and in English in very respectable scientific journals, biochemistry and trace mineral journals, and nothing happened. Just nothing happened. We sent all this to the appropriate people, and they just didn't even respond. Well, at the same time, when we looked at all those kids with cystic fibrosis and Qishan's disease, the selenium deficiency cardiomyopathy heart disease, 100% of them also had muscular dystrophy. We actually have pictures of this in the article. It was published in 1990. So anyway, here we come now. We're now in 2013, at the end, winding down for 2013. We're looking at an event coming up in 2014. It's going to be February 21st and 22nd, Friday evening, and pretty much all day Saturday the 22nd. Put on by Defying Muscular Dystrophy, a nonprofit organization called Defying Muscular Dystrophy. We're going to introduce you to one of the founders of that organization, and also a past muscular dystrophy patient. It's the tense here. And I want you to appreciate that we've been working on this for just about a year. The young man's name is Todd Harrison. He's 24 years old, maybe going on 25, has a beautiful baby son. And we've seen many, many things together over the last year with what we call the Wallach protocol. This is the 90 essential nutrients with extra selenium and a gluten-free diet. And Todd's going to tell you what he's seen in kids of all ages and so forth, and young adults in his age and so on. And this is very exciting because we have a book coming out at about the same time in March. The book is coming out, Epigenetics, and the subtitle is The Death of the Genetic Theory of Disease Transmission. Of course, the medical system is willing, short of burning at the stake, do whatever they can to destroy you if you go against their theory that cystic fibrosis is genetically caused. The same thing is they have a theory that muscular dystrophy is genetically caused, but it's not. Neither one of them are genetically caused. They're both caused by simple nutritional deficiency during pregnancy or immediately after pregnancy while the baby's breastfeeding, or they can get it later on in life. There's people who are clinically normal. I've met one lady who's in her, I'd say, mid-30s. She did not have any clinical diagnosis of muscular dystrophy until her daughter was born with muscular dystrophy, and then she began to have problems, and they diagnosed her with muscular dystrophy after she had her baby. And so there's all kinds of scenarios here, but muscular dystrophy is not genetically transmitted. Cystic fibrosis is not genetically transmitted. And this is going to be quite the thing happening in February 21st and 22nd. And, of course, in the book, the subtitle of the book, Epigenetics, coming out in March of 2014, is The Death of the Genetic Theory of Disease Transmission. I'm very, very excited about this for two reasons. Number one, we're going to be able to help millions of kids across the world. We're going to help millions of kids throughout the world with this information, that by the mothers, prior to conception, supplementing with all these nutrients, particularly minerals, particularly selenium, there will never again be a baby born with muscular dystrophy, cystic fibrosis, or die of cardiomyopathy heart disease, which is really the cause of sudden infant death syndrome also. And so we're very excited about this, and we're going to submit the articles, the book, and everything else to every university, every pediatric hospital, every foundation that raises money for these things to get everybody on the bandwagon here, because we can save the kids who are now diagnosed with muscular dystrophy and cystic fibrosis. We can also prevent any more cases of it. And what we're doing, and I'm going to let Todd, when we get through the Pearls of Wisdom here with Doug, when we talk with Todd, he's going to tell you how you can participate in this. And we're so excited because this is a not-for-profit organization. If you're looking for a place to have some tax deductions for donating money, this will be a great place to do it, because this is going to reimburse people who are participating in the study. They're going to give us all their records from the beginning until now. They're going to pay for their own supplements for the program. And this is the money that's donated is going to be a reimbursement for these people who participate. So it's all going, 100% is going for the cause, not 20%, not 30%, not 50%, 100%. Okay, stick with us. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a little bit about knee surgery, as I've got a study here that came out of Finland and was actually published in the New England Journal of Medicine, where the headline of this Reuters news story reads, "Common knee surgery ineffective in study." So one of the most common types of knee surgery performed in the U.S. is no more effective than fake surgery, at least for the first year, according to the new study. So this is evidence that doctors should give pause before they try to repair a meniscus, which cushions the bone of the knee. And, of course, they looked at 146 volunteers whose knee pain appeared to be caused by wear and tear of that cushion. None of the participants had a recognized injury or osteoarthritis. Both situations are usually considered surgery for and it's already known that for that type of surgery this type of surgery is ineffective. And I say 12 months on average, the improvement they received was, whether they got the real surgery or sham surgery, was basically the same, according to the lead author, Dr. Teppo Järvinen of the University of Helsinki.
When was this published?
Well, I got the story, just came out today, so it had to have been probably the most recent issue of New England Journal.
In 2013, yeah. Okay.
Yeah, and so they say that there's no significant improvement in knee pain after exercise, or no sizable improvement in the likelihood that the patient would require subsequent knee surgery. And, of course, there's always going to be the naysayers. There's Dr. Craig Bennett. He is the chief of sports medicine at the University of Maryland Medical Center. He cautioned that the findings should not be overgeneralized. He said people with knee pain who seem to be candidates for meniscal repair, suffering because of the debris in the swollen knee joint. If you scope the knee without touching the cushion, that will often help, even if you don't completely address the torn meniscus issue. Arthroscopic examination, where fluid is injected to give doctors a good view, you're actually taking out junky, thick, irritating fluid that can cause people a lot of pain. They say during both the sham and repair surgery, small holes were poked through either side of the knee so doctors can insert instruments to examine the joint. With the surgery known as arthroscopic partial meniscectomy, they say damaged or loose pieces of the cushioning material may be taken out that interfere with the motion, and they trim this away. They say about 700,000 of these are done every year in the U.S., costing patients about $4 billion. That's billion with a B. And according to Järvinen, he says, well, these findings won't be welcomed with open arms. And, of course, he's right, because with that much money lost, they're going to be thinking, oh, no, that's just sham reporting, sham study, so they can continue to cha-ching factor their $4 billion a year.
Well, you're exactly right. Back in July of 2002, in the New England Journal of Medicine, the Harvard School of Medicine looked at 300,000 people who had had knee surgeries for meniscus problem, ACL problems, and so forth. And the headline was, in the New England Journal of Medicine, knee surgery for arthritis worthless. That was July 2002. We're talking about 11 years ago. And this has repeated that study. So there should not be, unless you've been run over by a concrete truck and your knees pulverized into dust, don't get knee surgery. Give Youngevity, give the Healthy Bone and Joint Pack, give Dr. Wallach 90 days. Give me 90 days. If I fail, you can always get the surgery. But if you get the surgery first, you can't always get uninfected, unsurgery, unparalyzed, and undead. Give me 90 days. You probably won't get the surgery. Well, stick with us. We're going to be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. We do have lines open. Toll free, 1-888-379-2552. Again, that's toll free, 1-888-379-2552. Please restrict your questions to muscular dystrophy today. We do have Todd Harrison, one of the founders of DefyingMuscularDystrophy.com. We are having our first telethon with this organization for muscular dystrophy coming up on February 21st and 22nd, and we're very excited about this. Todd, you there?
Yes, hello, Dr. Wallach. We're ready to change the world.
We're ready to change the world. You got it. And what I want you to do is I'll ask you a couple of questions, and I'm going to turn it over to you so you can kind of give a scenario. But let's see here. You're 24 years old now?
Well, 25. My birthday was last week.
Well, there you go. 25 years old. Congratulations. And let's see here. When were you diagnosed with muscular dystrophy yourself?
I was diagnosed when I was 3 years old.
Okay. And when did you decide to kind of take the bull by the horns, the bit in your teeth, and run with this and do something special instead of just simply remotely following the doctor's instructions? When did you decide you wanted to do something different?
Well, I gave up hope in mainstream medicine when they basically just told me, oh, there's only steroids for you to take. And I always knew that there would be something else out there instead of drugs or steroids.
Yeah, how old were you when that happened, Todd?
That was probably about 15 years old when I lost complete hope and started searching elsewhere.
Okay, so 10 years ago, this started. And let's see here. So your mom and your uncle Dave and yourself founded this organization, Defying Muscular Dystrophy, a legitimate non-for-profit. You've already raised money and did one FDA-approved study, right?
Yes, the results for that will be released in February as well. So we have a very big year coming up. Okay,
super. And, of course, we're going to have lots of those books, Rare Earths Forbidden Cures there, also to have available for people. It'll be about a month early for the epigenetics book, but the Rare Earths Forbidden Cures book will be there. And I want you to be signing them as well as me, okay?
All right, that sounds like a plan.
Okay, now tell me a little bit about the organization, Defying Muscular Dystrophy. How many people do you have loosely associated with it? How many people do you have on the Wallach protocol for muscular dystrophy? And what have you seen over time, with kids 3 years old, 5 years old, 10 years old, and so on?
Well, I have about 20 people on the protocol right now from ages 5 to 30. And the most remarkable improvements are from the children, of course, the 8-year-olds and 5-year-olds. For instance, a few kids can get off their four-wheeler by themselves and their parents no longer have to pick them up. And a 5-year-old, he's able to run and bend his knees now when walking, and he can also get up off the floor without using his arms. So some very huge improvements.
That is a huge improvement because that's one of the early sort of suspicious clues that a kid has muscular dystrophy when they squat down and they can't get up without using their hands. Yeah, very good. That's so right. You're starting to see some stuff already. Very good. And how many people do you have attached to Defying Muscular Dystrophy? You told me at one time there was some number associated with it.
We've grown to 4,700 people on Facebook. So we're moving up on the ranks on that, being the 4th largest muscular dystrophy organization.
Very good. So we got to run one of those message moments, so hang on. We're going to get you to share some more information with our listeners after these messages. Now, Todd, let's talk about what you've seen in your own self. You started about a year ago with the Wallach protocol, and kind of what state were you at? Because you were doing lots of stuff on your own from the time you were 15 years old, and so where were you at when you started, and where are you at now a year later? Well,
before I started longevity, I was eating all of the bad foods that you say to avoid. I would experience a lot of fatigue easily, and it would sometimes take me 2 to 3 days just to recover from exhaustion. In 2012, I experienced a dramatic loss of strength pretty quickly, and I didn't discover you until January of this year. Someone had sent me a video where you were talking about Marvin Rupp and how the Amish community had higher amounts of muscular dystrophy cases. And quickly I did my own research and verified the information and started my nutritional road to recovery with a full longevity protocol, including eliminating the 10 bad foods. So I've been taking the supplements for about 9 months now, and my improvements have been immense, Dr. Wallach. My walking gait is getting better and better with more control and balance. I am seeing new muscles and feeling new muscles. My arm strength has improved dramatically as well. For instance, back in late October, I was only able to do 6 tricep extensions with a 10-pound weight, and today I have that number up to 29 reps.
Wow.
So, and
it's almost a 500% increase. Yeah.
Yeah, some crazy number like that. And as far as my leg strength goes, that has been good as well. In 2011, I did a 6-minute walk test at a Muscular Dystrophy Association clinic, and I was only able to walk 336 meters in that 6 minutes. And now this year, it's jumped up to 370 meters thanks to the longevity protocol.
Wow. Fabulous. That's also a 500% increase from 600 to 3,000, do you say?
336 to 370 meters. So
okay.
20%.
Okay, well, it went up. Fabulous.
Yeah.
Okay, now, you've seen equal or better results in the younger kids, the ones that are 3, 4, 5, 6, 8, 10 years old.
Yep, I've seen them get up off the floor without using their arms and starting to run a little bit and improved walking.
Yeah, wasn't there one little kid, 3 years old, who had not really even been put on a tricycle or something like that, and he was watching his cousins or brothers and sisters do it, and one day, after just being a few weeks on the program, he gets up, walks over, gets on the bicycle, starts riding around, dinging the little bell.
Yeah, they were just gluten-free and just taking the Beyond Tangy Tangerine, so they added in the protocol since then, though.
Okay, so they hadn't been even adding the extra selenium yet.
Nope, it was just the Tangy Tangerine, and that was pretty incredible itself.
Isn't that amazing? Now, what are we going to expect, and how can people register for this telethon? If they want to come physically, to the banquet on Friday night, they have to register and come to the speaking and the panel event on Saturday to go through all the protocols and who did what and so on. And then, of course, people who want to get on your Facebook and YouTube and all that kind of stuff so they can get the news release, how do they do that? We got to run with those message moments, so be ready when we come back. We'll let you tell them how to participate, how they can make donations, how they can actually participate live themselves at this telethon, February 21st or 22nd. And we're just excited because We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. You do have lines open. Give us a call toll-free, 1-888-379-2552. And that's toll-free, 1-888-379-2552. Please restrict your questions to muscular dystrophy today. And Todd Harrison, representing DefyingMuscularDystrophy.com, a non-for-profit organization. When was this established? How old is the organization, Todd?
We established it in 2010.
Okay, so it's almost a 4-year-old organization. Already has one to-be-published FDA-approved study coming out already. And I'm very excited. How can people get registered for this telethon on the 21st and the 22nd of February?
Well, the first thing you'll need to do is just go to defyingmd.com, and you can get all the information there, including the reimbursement project.
Okay.
And if you can't make the banquet dinner, you can also donate.
Oh, absolutely. We're looking for donations to reimburse the families who have extended themselves, who've gone out of their way to provide us with the laboratory data, their diagnostic biopsies and blood tests and all this kind of stuff. And they followed the protocol exactly. They bought their own products, and insurance isn't paying for it, and so we want to reimburse them. And so 100% of the donations will go equally divided between those that participate. So we're very excited about this, and please do show up if you can. We want as many people there to see as many people as they can see what's going on. But if you can't, you can get online on defyingmd.com. You can go on Facebook. You can go on YouTube. And if you want to be sent, especially if you're in the media of any kind, or you know somebody in the media, radio, television, newspapers, magazines, non-for-profit organizations looking for something to do yet this year with their donations, get a hold of the press release. How big is this press release going to be here, Todd?
Well, it's going to be pretty big. It's going to come out in the next few days, and we're going to be, like you said, we're going to be sending it out everywhere.
Okay. And, of course, it goes into a little bit of the history of the organization. It gives the officers of the organization. It has myself and Dr. Glidden as a part of the Scientific Advisory Board. We're very excited about this, that we're doing the scientific advisory part of this thing. And Todd and his mom and their board and group are doing the rest of the organizational stuff and doing a great job. And I just can't tell you how proud I am of Todd and his family and their organization, because if I'd have had this kind of organization 35 years ago for cystic fibrosis, there wouldn't be another kid with cystic fibrosis. So we're kind of piggybacking the cystic fibrosis thing a little bit on top of the muscular dystrophy stuff, because they are related. They're caused by the same thing, and each has both, or each actually has three diseases: cardiomyopathy, heart disease, the cystic fibrosis, typical stuff of the heart and the pancreas and the liver and the muscles, and so do the people with muscular dystrophy. And the most common cause of death from all of them is cardiomyopathy, heart disease, which is a simple selenium deficiency of the heart. And, of course, you can have a overt selenium deficiency. There's plenty of places around America that have little or no selenium in their soil. And so if you eat locally from your local food markets, guess what? Most of your food's not going to have selenium in it. And then if you're not supplementing, you're going to be low in selenium. And if you have a gluten intolerance, you're not absorbing very well. Let's say you're only absorbing 15% of your food, and your soil only has 20% of what you might need. What's 15% of 20%? Not very much. And so that's why there's areas, especially where people like the Amish, who just live totally on what they grow themselves, where they happen to be with their farming and everything, is very high levels of muscular dystrophy and cystic fibrosis in these families. So Todd Harrison here is the point of the spear in this whole thing, and it's just been a real blessing for our relationship with him and his organization and his family. They are true American patriots, and I can't say enough good things about them, because their whole thing is to make sure that these other kids out there get the information, the other families out there can get this information to save the kids that already have the problem, and to actually prevent more kids from having muscular dystrophy, cystic fibrosis, and cardiomyopathy, heart disease. So, Todd, what's going to happen on Friday night at the banquet and on Saturday for the panels and talks and speeches and everything?
Well, on Friday, February 21st, that's going to be the banquet night where we're going to focus most of the fundraising on. And then the following day, we're planning to launch the telethon and possibly a live webcam show as well.
Oh, that would be fabulous. That'd be fabulous. And so you'll arrange that with all your associates and everything who have, where they need a Skype set up or what?
Oh, no, it'll be able to be live streamed online, like something on YouTube.
Oh, okay,
something
YouTube.
Very simple.
Okay,
yeah.
Good. Well, it's simple to you. I'm not a techie guy, so I really appreciate your skills in those areas. Tell us some more about what you've seen in older kids, people who are in their mid to late teens and even early 20s. Do you see improvement in them?
Yes. One 25-year-old with Duchenne muscular dystrophy, he has to use a feeding tube, but 8 months ago, before he started Youngevity, he only weighed 73 pounds, and now he's 98 pounds.
Okay, wow. So he's put on almost 25% of his weight, yeah?
Yeah, just in 8 months. That's an amazing story.
Yeah, and does he feel stronger? Is he happier? And is he kind of excited about his future now?
Yeah. He says that his muscle is definitely coming back.
Yeah, it's an amazing thing.
All his family members...
I'm sorry, you say his family members are what?
All his family members are definitely noticing his improvements as well.
Oh, okay, good. Yeah, well, this is the sort of thing you'd expect. Kids who are diagnosed at 2-3 years of age will respond extremely quickly because they don't have a lot of scar tissue and a lot of damage over a long period of time. And then kids that are, say, 5 to 10 will also show rather quick recovery. And then ones from, say, 10 to 15 might take 4 to 6 months to see something really dramatic. And ones who are maybe 12 to 15, it takes a little longer. Those from 15 to 20 takes a little bit longer. And this is pretty typical. I mean, you get somebody with rickets and who's, say, 40 years old, and they got their bow legs and all these different deformities of their bones because they had rickets as a child. You give them vitamin D3 all you want, nothing's going to happen. And so to be able to see this kind of improvement, even 5, 10, 15, 20 years after diagnosis, is one of the wonderful things about the ability of the body to recover when you give it the exact right program it needs. So we're very, very excited. And how many people do you think are tracking their progress with film every 2 weeks, Todd?
I have about 5 people on video. So once we get more people, we're definitely going to be releasing a lot of videos on YouTube. So
okay,
we'll be able to track progress like that.
Okay, and are these videos you have, are these on Facebook or YouTube now?
Yes, there are already a few on YouTube right now.
Okay, super. Well, let's see here. And what do you weigh now?
I'm 128.
128. And just kind of a thumbnail, how much does it cost you a month for your supplements at this point?
Probably only $150. I've already taken half the price off.
Okay. You've taken half the... How'd you take half the price off?
Well, I started the Longevity business way.
Oh, okay. So you got a check coming in from Longevity, so that deducts from your total cost. So if you weren't getting a check from Longevity every month, it might cost you $250 to $300 a month, correct?
Yep, that's right.
Okay, well, hang on. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And let's see here, Doug, we're going right back to Todd in Stockton, California, which is where the telethon is going to be. Is that correct?
Yep, that's right, Stockton, California.
Okay, where's the banquet going to be at on Friday night? Or is it
it's going to be at a dinner hall?
Okay, that is Friday the 1st, correct? Or 21st, excuse me,
yeah,
21st. Friday the 21st.
The 21st.
And so it's going to be at a dinner hall. Do you have the name and location? People do have to make reservations in advance, so you know how many meals.
Yes, all that information is on defyingmd.com under the crab feed tickets.
Okay. And then the venue for the thing on the 22nd on Saturday, and how long is that going to last? Is it going to go from 9 to 5, or how long is that going to be?
That event will be from 5:30 to 12.
Okay. That will be on the 21st?
Yes.
Now, what about the one on the 22nd, the talks and all that? How long is that going to be?
That should be about 2 hours.
Okay, so that'll be 2 hours. And, of course, what time is it starting?
9 a.m. and
9 a.m. to 11.
a.m.
So 9 to 11 will be question and answer, maybe until 12. So officially 9 to 11, but could be from 9 to 12. And obviously, if you can't make it to these locations in person, but you want to make donations, there's obviously the mechanism to do that online, defyingmd.com. And I'm so excited about this because we're going to be able to save a lot of kids here in America and in the world. And I can't thank Todd and his family and his organization, defyingmusculardystrophy.com, defyingmd.com, because we've actually put theory into practice and made it happen. And without Todd's help, it would be a little difficult. We've done this in the Amish community, but because of their religion, they're very secretive and don't like pictures of themselves taken and all that kind of stuff. And so although we have, dozens, in some cases hundreds of kids in the Amish community who also had great results, they're not allowing us to have these kids up on stage and be our poster children and so forth. They're very secretive, and so we have to use the data from them for the ultimate article, which is coming out here in the book. And we have a scientific article, too, that we're going to put together and have published. And the numbers, including the Amish communities and the Mennonites and the Hutterites and the others that are involved, but they're very secretive types of people. They don't want to be publicly noticed. Their data will be available, but not their names and pictures and locations, that kind of stuff. And so that'll all be part of this big final push that defyingmd.com is going to put together. So keep in touch with the website, the Facebook. Please donate, because we want to reimburse all these families that have just really participated. And if there's money left over, we'll just redo the whole thing again and again and again until every kid in America is cured. Okay, we're committed to that, because once you know the secret, once you know how to prevent and cure a disease, you're driven. You can't sleep knowing that somebody might have missed it. And so we're going to get it out there. And I just can't congratulate and thank Todd Harrison and his mom and his uncle and everybody involved in the Defying MD organization, just how much I appreciate them using all their technology knowledge and their physical energy and their resources to make all this happen. And so you want to have a final word out there for the general public, Todd?
Just get ready for 2014. We got some huge things planned. We're about to change the world and save thousands of people.
And this is coming from a young man who... You weren't medically trained, were you, Todd?
Nope, not one bit. Just somebody who wants to stay out of a wheelchair.
All right. Well, congratulations. Can't thank you enough again. And just this is super stuff. These are the sort of things that make history in the medical circles, despite the medical doctors. So hang on. We're going to make it happen. Thank you all for listening today. Thank you, Doug. Superlative job as usual. Thank you, Todd Harrison, for being there. I know Shar was on. Thank you, Shar. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.